Our next speakers are Chris Carberg and Linda Reinstein. Linda, of course, needs no introduction. And Mr. Carberg is a digital specialist. I'm sure I have come nowhere close to what you do. In any case, I think they have some interesting new directions forward for ADAO to discuss with us.
So Chris and I are going to do that unusual thing. We're going to share 10 minutes, but we can do that. This is a really important, session 3 is all about prevention. We know so much and we've done so little really to alleviate 40,000 deaths every year. So ADAO has been doing this work for 20 years, as you know, thinking about technology and how things are advanced. I come from the old slide rule era. I don't know how many of you were scientists back then. We carried around a long slide rule, and that's how we did our calculations. Well, we don't have to do that anymore. So it's been my job as an innovator and a businesswoman to figure out how do we maximize ADAO's voice, resources, momentum, and vision to get it done. So technology has always been a focus. So this session is all about what is ADAO doing now to make technology work. So let's talk about it. So there's the intro, and it is all about negotiation and communications for us. So if we can't have those dynamic conversations with facts, we lose members of Congress. The media doesn't necessarily understand. We miss our opportunity, not an option. So I've been learning AI on my own for 3 years, and I thought, why don't we have a chatbot? So working with a student in Amsterdam, I built a chatbot this last year for around Global Asbestos Awareness Week. Now, it's not exactly like Field of Dreams. If you build it, they will come. It takes a lot of maintenance, an uploading of documents. It's not simple. So I see why some people don't. But we have the moat. There's water in our moat, and we have the information. 20 years, 4 websites, 3,000 documents, etc. Information should not be difficult to get. Access should be free, easy, and spontaneous. We don't want to see natural disasters where someone can't figure out what they need to do. It's unacceptable. So looking at that, we have really worked hard to build our chatbot. So take a look. There's been a lapse with this conference, so I'm behind. But what if you can translate what we know in 100 different languages with 1 click? Don't you want to do that? I mean, that's a hell yes. So knowing that our stories are essential. And Chris and I have worked together like brother and sister. We produced that book that many of you were given today, 200 stories. Now we can translate the stories in other languages. We can share that book for free. We can send that book to other countries. And clearly in our world, it is inexcusable for the United States not to be on the forward-leaning edge of prevention. And we're here to get it done. I'm going to turn the mic over to Chris because we connect the dots at ADAO. We want to get it done with all of you. We have the science, we have the information, we have a path for justice. It's time. And I'm not very patient for those of you who've met me. I'm impatient when people suffer. So I'm in go mode. Join us.
Thank you. Thank you. It's always fun to come right after Linda because there's so much energy just surrounding this podium right now. Yeah, you were pretty close on the digital specialist side, but yeah, I kind of come from a marketing and technology and creativity background where there's no real answers to anything. And so I've had an opportunity to kind of create digital products in a variety of spaces, from addiction, behavioral health, in the mesothelioma space, we're working with an MIT group to try and diagnose postpartum depression earlier. But for the last few years, working with Linda and ADAO has really taught me something very clear, and I think you've all heard it, that prevention really is greater than cure. And it's what Dr. Flores has emphasized, and it's why many of us on the tech side have really focused now on prevention. What we face online is that when somebody searches a query on Google or ChatGPT now and says, I might be in danger, by the time they search for many, especially those with mesothelioma, it's too late. And so AI is kind of giving us a chance to shift some of this by giving us prediction. Prediction is not better than prevention. Predictive models help us recognize at-risk groups earlier and then target those. But you know, when we kind of look at creating products, one of the things we did last year was the Every 13 Minutes site, every13minutes.org. And the goal there was to identify kind of proximity to these diseases, because a lot of people don't realize how they are actually affected by this. This is affecting someone in their family who has lung cancer, and it was from asbestos, and they didn't know it. So we try and create those. But when we're creating products, I thought I'd give you a quick story about how we approach it. When my wife and I had co-founded postpartumdepression.org, after she had battled that, because creating products is kind of like a coping mechanism for me, we wanted to reach moms before it was too late. So we started looking at our site data, and we discovered the highest activity was between 1 a.m. and 4 a.m. on Wednesday mornings. It wasn't rock solid science yet, but it gave us a hint to say, what could we create for that audience that is needing something? So we hypothesized that a mom is sitting in the dark, feeding with their baby, and we said, well, shouldn't our screen be dark then? We don't want to wake up the baby. We don't, or if she's trying to put the baby down. So we created products around that. We've done the same in other spaces, but we're trying to keep doing that here with ADAO. And we've kind of looked at it as a goal of launching new digital products each year. So as I said, last year, it was every 13 minutes, personalizing the asbestos deaths, 110 to 113 a day. And then we have the source, which is life-saving Q&A. And then the new thing that we're going to be launching is this action navigator that is going to be focusing on 3 different areas and uses AI to kind of accomplish that. So it starts with prevention. There's a lot of searches on Google and on ChatGPT about people who are renovating, people who are working with old cars, people who are, whatever it might be. And this gives them an opportunity to kind of get those answers. The second is going to be exposure. And so how can we track and document the risk points? And then the third is care. It's guiding patients and families through a diagnosis so they can take actions and have a sense of confidence as they face it. It's mobile first, and it's, the idea is awareness, action, and advocacy. But the greatest impact, I think, of what we're going to see with AI is allowing experts and advocates to amplify their experience and deliver help where it's needed most. So for us, the mission is the same: to create tools and materials that bring personalization and proximity, because that's what turns awareness into action. Thank you.
So when Chris and I co-create, we just whiteboard it. We throw ideas, we know our time and what's executable and possible. So don't worry for the Science and Prevention Board, we're not going off. I'm not coloring out the side of the lines right now. You'll have a chance to review. But we want to take the 3 buckets that ADAO gets is, what is it, where is it, what do I do? And kind of frame that around prevention if you have been exposed and if you have been diagnosed. So we actually have a beta app. In fact, we've been too busy to finish it, but you as conference attendees will get a link to it, and we'll also include the chatbot that ADAO built, and of course, Chris always weighs in. But using AI is going to be essential for ADAO to extend the moat around our work, and to be honest with you, industry can't catch us. They can write all the bad junk science they want to write, but we have something more powerful. We have the truth, and we have technology that allows us to get in front of it and log it and set the story straight. So we look forward to showing you our latest app and getting feedback from our Science and Prevention Board members. But the medical side is really going to be from patient advocacy about how can we take our learned experience and share them on mobile. So thank you for letting us talk about the new project. We look forward to sharing it.